My name is Benito Novas, and I consider myself not even an entrepreneur. I would say I'm a survivor. And I left my country of origin. I'm of Cuban descent. I left my country of origin very young, and looking for better opportunities of life, to make my life, to be able to be free, to be able to prosper, to be able to provide for my family. So I went in the United States. Once I got there, I was looking for a career change, and I came into the medical field. I became a consultant for the medical industry, and I found myself involved in the stem cell field. At the time, I found that tissue regeneration and stem cell arena was going to be the future of medicine, and I became really passionate about its potentials and its capabilities. I embarked on this journey, which is like a 15-year-old adventure. I founded what is known as the Global Stem Cells Group today. The first idea behind the name was to be global. It's a big world, and there's a lot of people to help, to benefit. There's a lot of doctors worldwide, and there's a lot of business to grow and expand. Under the Global Stem Cells Group, you're going to have several entities. The first one will be the ISSCA. It will be International Society for Stem Cell Application, that is in charge of spreading intellectual knowledge and the practical knowledge of how to practice regenerative medicine today. So this organization is constantly adding trainings, going around the world, one small group of physicians at a time, getting them trained, getting them certified, empowering them through conferences, workshops, seminars, online platforms, fellowship programs. So it's a learning institution. The ISSCA operates in 35 different countries. Then you have Cellgenic. Cellgenic will be our brand of products, equipment, reagents, everything that's needed to manufacture or distribute a cell therapy product goes through the Cellgenic line. Then you have our network of clinics, like at the Cellular Hope Institute. We not only teach these doctors, but we practice what we preach. So we have our centers around the world where we have our own clinics, and that we empower other doctors to belong to our clinic network, where we gather all these like-minded doctors, physicians, and practitioners that want to share data, that want to work under the same banner, that want to do things the way we do things. Now the Global Stem Cells Group has become a powerhouse, and I'm proud to say that from its humble beginning, we're now one of the key players in the field of point-of-care regenerative medicine. We're the largest company in regards to training and certification of physicians worldwide. We want to grow it, of course. We want to continue to expand our knowledge, which is, I think it's been one of the keys to our success, is that we never hog any type of knowledge or any type of technology, but on the contrary, we've been in the business of spreading knowledge out, or spreading intellectual property, or trying to get more people to practice this. So in the global sense of changing the industry or changing the world, the dream will be to see regenerative medicine becoming standard of care and the first line of treatment for every disease. It's full of challenges. That has been the most challenging endeavor of my life, but I'm proud and happy to say that we're still here, we're still fighting, we're still growing.